So one of the questions I commonly get asked pertaining to surgery for post-herpetic neuralgia has to do with what should I expect after surgery? How soon should I expect to feel better, and what should I expect in terms of the timeline? So that's a little bit of a tough question to answer, but I'll answer it as best I can. Um, it's been my experience that typically after shingles surgery, and again, this isn't true of every patient, but this is true for a lot of patients. Typically after shingles surgery, um, patients will find for a few days they feel really good. Pretty similar to how they felt immediately after the nerve block that we did to temporarily turn off the pain. And part of that is because they've just had the surgery to treat their problem, and part of it is because, depending on which part of the body it is, we've also done a long-acting nerve block in order to help with post-operative pain. Now, that nerve block will last anywhere from a couple of days to maybe as much as a week. And so most patients should expect that somewhere between 5 and 10 days afterwards, they're gonna experience some soreness and maybe some pain, which should be manageable, but it's to be expected. It's part of the surgical healing process. And so it's important not to lose hope or to freak out when you feel like you're getting worse after the surgery. That's a normal part of the healing process after the surgery. It's a function of the different medicines wearing off and your body starting to get accustomed to the healing process. So this is one of the reasons it's really important to continue taking the ibuprofen and the Tylenol and the gabapentin, or some patients will be on Celebrex instead of ibuprofen. Some patients will be on Lyrica instead of the gabapentin. But that's why it's important to take those medicines as we originally prescribed them, even before the nerve block wears off, to start with the gabapentin or the Lyrica the night before surgery, and then also to continue with that as prescribed. Same thing with the ibuprofen and the Tylenol, because that will help prepare your body for when the nerve block starts to wear off and make sure that all of that post-operative, that surgical discomfort is being addressed really well. In some cases, we can repeat the long-acting nerve block to help patients to get through that initial phase of their surgical pain. Most patients don't need that. It's pretty uncommon for us to have to do that. What most patients will notice is that over the next month after surgery, they'll get progressively better. A lot of patients will find that by 1 month after surgery, with the exception of some soreness, they're feeling pretty good. Now, here's something else that's really important to keep in mind. It is not unusual. As a matter of fact, it's pretty common to have what some patients describe as zingers, or little electric shocks from time to time, or maybe a brief burning sensation where a few minutes ago they felt fine. That's also part of the healing process. It's also very typical. It's also very normal. What you should expect after surgery is that those moments of those zingers or those electric shocks should become less frequent and less intense over the next 6 to 12 months after surgery, until eventually they just go away. And that's another thing to keep in mind, that as you continue to heal from the surgery, you're going to have good days and you're going to have bad days. And that's also normal. That's also to be expected. And what you should expect is that as you continue to heal, your good days will become more frequent and your bad days will become less frequent and less intense until finally you don't have any more bad days for most patients. And again, that process can take anywhere from 6 to 12 months after surgery. So are there patients who wake up from surgery and they feel awesome and they never have a single bad day after surgery? Sure, we have a lot of patients that are like that. But does it mean that the surgery was a failure or that you did something wrong if you don't fall into that category? If you're one of those people that has good days and bad days, no, there's nothing wrong with that. That's pretty typical. Some patients, there's a small percentage of patients who will find that somewhere around 2 months after surgery, they start to have an intense recurrence of their pain. Their pain comes back and it gets worse until about 6 months after surgery, at which point they're really, really concerned. In a lot of patients, this is what we call rebound neuropathic pain, meaning that the pain has come back and it's nerve-related pain. But in many patients, this is actually a very good sign because it's a sign that the brain is trying to adapt to the new sensations that it's feeling through that nerve which has been disconnected from the original cause of the pain. And in most patients who experience that, what they'll find is that somewhere around 6 or 7 months after surgery, they start to finally turn the corner. And by around 9 months after surgery, they find that they feel like, oh yeah, now I'm really starting to notice that I'm feeling significantly better. And by 1 year after surgery, they've noticed a dramatic change. Does that happen for everybody? No, it doesn't happen for everybody. Thankfully, a large percentage of patients don't have any of that rebound neuropathic pain. But the patients that do, the vast majority of them feel pretty good a year after surgery. And so my advice for you at this point, and this is the hardest part of everything you're going to have to go through, is to wait, to be patient, and to allow your body time to heal, to do what it needs to do. Is there a possibility you may need further surgery? Yes. Is there a possibility that your original problem was hiding another problem and that now that second problem is obvious when it wasn't obvious before? Yes. And don't be discouraged by that. We will continue to walk with you. We will continue to try to figure out what's going on. Most patients, they don't even have to be concerned about this. But if you happen to be one of those people that falls into that category where you still have symptoms even a year after surgery, it doesn't mean that nothing can be done. What it does mean is that we need to revisit your concerns and see what else can be done and then go from there.